Well, hi friends, it's Jennifer. Welcome to my channel. I am coming to you on the heels of a crazy 3 days. I'm honestly still a little in shock. I'm still taking everything in, still gathering a lot of information. I'm not sure if all my testing is done, but after having my annual mammogram. Now, this year I was supposed to get my very first contrasted mammogram, and I'll get into that a little bit later. But after receiving the news from my annual mammogram and going now through a variety of tests and biopsies, I have been diagnosed with what's called DCIS. It's intermediate, and it is hormone it has hormone receptors for estrogen, intermediate, and then high progesterone. That is the diagnosis. It is a non-invasive form of breast cancer, but the treatment is nothing small because it can progress. The good news about DCIS, so it's called Ductal Carcinoma In Situ. It's a really unusual name. So ductal, meaning that the cells are within the milk ducts of the breast, and I think maybe any of the tubes. I'm not really quite sure about all of this right now. It has not gone outside of that to affect the tissue outside of the ducts, which is really good news. But oh my gosh, okay, family history, what I've been going through, what I've learned, what I'm looking at. I'm going to try to fill you in on everything. I'll be meeting with my family practice doctor today at 3 p.m. for a televisit, just to kind of look over everything. Now, they call it it's like a stage 0 breast cancer. And it's on my left side. I've got a 32 millimeter tumor that I cannot feel, by the way. That's there. Also, there was some area of question. So I guess like your breasts, okay, and I'm not scripted. This might be a little rambly, because I'm in the process now. Oh, I had to have blood drawn today. And if you've been, let me take that off. That's got a bloody piece. So if you've been watching any of my glucose lowering hacks, I just had blood work done today to get a blood work panel done for food allergies and food sensitivities, non-gluten celiac. I wanted to go and get that done today. I received my kit from a dietitian that I've been working with. So anyway, I have really, really thin, small veins, and my veins roll. And I'll tell you about that situation. Oh my goodness. People have a very, very difficult time drawing blood from me. So if it's something that can be done in my hands, I always ask for it to be done in my hands, and it's a lot easier. But anyway, this video is also to remind my sisters out there to make sure you're getting your annual mammogram, because things can change. Now, when I saw my family practice doctor back in November, she said that she did want me to get a mammogram with IV contrast because I have been diagnosed with having dense breast tissue. And what that means is, and it's not something you can feel necessarily. Like, you can't feel and be like, oh, this person has more fatty breast tissue. This person has denser, more glandular breast tissue. It's detected through a mammogram. But for women like me, and it's usually hereditary, which it is, on my mom's side of the family for sure. I'm going to have to ask my aunt, who is battling breast cancer, because remind me to tell you about family history, if she had dense breast tissue. But if you are somebody who is diagnosed with having dense breast tissue, you also want to get a mammogram with IV contrast, because of the density of the tissues. It can hide tumors. It can hide smaller the beginning stages of breast cancer. And of course, breast cancer, the quicker you get it, the earlier the stage is, the better the prognosis. That's why it's so important to make sure you are on your annual mammograms. And if you have dense breast tissue, to make sure you get the IV contrast. And I don't know if I'll have enough time in this video to share what that was like, but I will probably make several videos here about this since I'm going through it. I have experienced in just 3 days my annual regular mammogram, then my mammogram with contrast. And you actually, before you get your mammogram with IV contrast, you have to get your annual first. And actually, my annual mammogram did pick up calcifications, and evidently the breast is it's like dissected into 4 parts. And my tumor of 32 millimeters in the calcification, what it is it's dying cancer cells that have died, and they that's what is the calcification. And so radiologists, when they see calcifications on a mammogram, it can either be the normal, it can either be, as in BE, just the normal aging process, but depending on the border of the calcification, the location of the calcification can signal flags, and that's what mine did. Mine was located in the upper left quadrant of my left breast, and that is, from what I've read, where a lot of breast cancers start. Now, there was an area of question on my right side that the MRI with contrast picked up that was located in a different quadrant of the breast, which is where the lymph nodes are. I had an ultrasound for that. The ultrasound couldn't see anything, but the doctor who ended up doing the biopsy on my left side said that depending on what the results were, and they do call it malignant, it's just not invasive, that we might have to go in and get a biopsy on the right side, because the doctor who did my biopsy thought it might be lymph nodes. It could just be they're swollen or inflamed, nothing serious. So that will definitely be something I'll be talking to my family practice doctor about when I take a sip. Okay, like I said, I'm all over the place here. I'm still kind of a little in shock, and I'm still in all of this gathering situation. So I had my annual mammogram, and then on that, it had this calcification irregularity that triggered a flag. Thankfully, I was already scheduled to have my mammogram with IV contrast already, and that was a whole unique experience. And maybe I'll just save that one for a different video, and maybe I'll start a little DCIS intermediate playlist for anybody who may go through it or may want to go through it, because my journey, woo, you guys, it's just beginning. I mean, the team, oncologists, doctors, surgeons, are really on treating it, because DCIS can progress to invasive breast cancer. But if it's caught early and treated, and depending on your family history, it's a really great prognosis. It can reoccur. And I have also read that, so when women have had those tumors removed, so, the surgeon will go and say, if I get a lumpectomy, the treatment for it is a lumpectomy with or without radiation, depending, or a mastectomy. It can come back. Yeah, so it's not a small thing, the treatment, but, and I think I started this at the beginning. Like I said, I do apologize if I'm a little rambly and all over the place. That is the state of my brain right now. I am all over the place. I got the news yesterday evening, and I'm gonna have to share all of that probably in a different video. I really feel blessed that, I mean, it was under a day that I got the results, which normally it takes at least 2 days. And I mean, God has really blessed in allowing me to get right into these procedures. In fact, even my radiologist, I worked with the same radiologist all 3 days. And then the doctor who did the biopsy, she's like, wow, she's like, this never happens. She's like, we never get patients who are just get all these things done, like boom, 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 right after the other. And I just felt like it was the hand of God. I just really felt like God was blessing me. But where was I? Oh, so treatment for DCIS is no small thing. So lumpectomy with or without radiation. Or mastectomy. These are not small decisions, are they? And also your family history plays a part in that. And let me go back and tell you what I've learned about family history, or maybe I should tell you my procedure. Let me tell you my procedure, then I'll tell you my family history. Okay. So I had my annual mammogram, calcification showed up. That way then when I was there for my mammogram with IV contrast, actually, that's right. What had to happen was, so when I got that annual mammogram and it detected, some red flags here, something, because they were called rapidly newly forming calcifications was like the title. Then before I could do the MRI or the mammogram with contrast, I had to then have another type of mammogram that was a more magnified mammogram. Had that done first. The radiologist looked over, because they're like on site and in a different place where they look over, all the imaging. Once that was done, then we did the mammogram with IV contrast, and that was such an interesting experience. And then I had to have the ultrasound done on the right side because of the potential lymph node situation. Then I had a biopsy, and I will also share that experience in another video as well. So if you ever have to go through this, you will be a little more prepared. I had no idea. And the radiologists, the women that were around me were absolutely phenomenal. Just this wonderful radiologist. Her name was Annalyn, and that's not her. She has like a proper title. It's a specialty like within that field. And I mean, of course, all the women that are working with all of us women in mammography and all of the equipment and specialty equipment like the IV contrast and these other types of machines and the biopsies. I mean, these people have hearts of gold. And this one radiologist who was with me the entire time, her name was Annalyn. She was just such a blessing. So skilled, so knowledgeable, so amazing. The doctor was incredible and really, really skilled too, because she told me after she did the biopsy, she's like, we got a really good sample. She's like, we got really good calcification. We got really good sampling. And I'll tell you about that experience in a different video, because I was up on a table that was lifted up where there's a hole where your breast goes into an opening, and you are up prone with your chest down, and they have to secure you almost like when you get a mammogram x-ray, and it didn't hurt. It was like a gentle, wasn't painful, but you're secure. And they have to kind of move things around to basically get you positioned just right and then held in place. That way they have a clear path to any tumor site. And so these ladies were amazing, and the doctor was incredible. All right, I'm just going to I feel shiny. I'm sitting in my car. I've got my windows rolled up, and it's a little stuffy. But yeah, wow. I'm honestly just kind of like all over the place here. Anyway, so of course that biopsy sent to pathology, and I was able to get the results right away. And they did tell me a couple of times, they're like, you are going to get in your like my chart, like the patient my chart, they're like, you will get your pathology results before we will. And they're like, don't read it without your provider. And I'm like, oh, I'm so reading it. Like, the second I see it, I'm absolutely reading it. But they did give me a paper with like instructions for how to care for the biopsy site. And at the top was a nurse line. They're like, when you get your results, whether it's cancer or it's benign, they're like, call the nurse line. They'll just tell you what to do for, you know, the next phase. And they're like, call the nurse line. Well, when we got the results, and oh my gosh, it was such a shock. Like, I could not stop shaking. And of course I was crying. I was like, it just felt so surreal. I can't even explain it to, and I wonder if any of my sisters out there have been diagnosed with any type of breast cancer or DCIS. And it was just such a shock, and it was so scary, and like, oh, my dear family. And I'll save that for another video too, because I'm all over the place right now. We're 16 minutes in. I don't have a lot of storage on my cell phone, because even though I've been doing YouTube for 7 months, I only use my personal phone. Yeah, everybody's been amazing. This nurse line that I called after I got my results, whoever that precious soul was on the other end of the line was so incredible and calming. She gave me instructions on what to do, how to process it. She's like, the great news is that, like, this DCIS it's in its intermediate stage. It's not spread to any other tissue. That's good news. Even though the treatment is no small thing, it's very treatable, and that is the good thing. But it can reoccur. Lots of options. And interestingly enough, I'll tell you about my family history here, and then maybe just add to this video a different time, or adds, maybe I'll just make another one sharing a little more detail. But I hope you don't mind this more casual video. I know this one's not really like as put together. Okay, family history. So mom's side, dad's side. On my dad's side, I have learned, now I out of the 5 siblings of my father's side, so my father died of colon cancer when he was 45 years old. One sibling, one aunt of mine has breast cancer. She has now battled breast cancer 3 times, I've just learned. And she's such an amazing, wonderful lady too. My Aunt Joanne, she's really wonderful. She had DCIS twice. She was diagnosed with it, I think she was 51 years old or somewhere in there. She had a lumpectomy, no radiation. It did reoccur, and that's something that I'm very concerned about. It does tend to reoccur, I think, especially if you don't do radiation. She so for the second time it came back, I don't know what type of surgery she had or what it was exactly, but she did have it with radiation. And then just 2 years ago, she was diagnosed on the other side with, it's called HER, like HER, HER2 positive cancer. And she actually had to go through chemotherapy for that. And then I have another aunt who was diagnosed with pancreatic cancer, and she survived. I mean, like, that's got a real small percentage of survival rate, and she survived pancreatic cancer. But anyway, so breast cancer in the family. I've been talking with my aunt, who has been 2 years out now from her 3rd bout with breast cancer. So my grandmother had breast cancer, had a lumpectomy and radiation, and she never did have another reoccurrence, but she was diagnosed in her 60s. But then my great-grandmother had breast cancer and died from it at age 62. So that's not great family genetics. I don't know what that means exactly for me, but that's what we're dealing with. So I will be meeting with my telehealth with my doctor. I already had an appointment with her for next week because in fact, I am still going to go get my blood drawn tomorrow. I am gonna do a fasting blood draw because I'm getting my glucose, my A1C number checked, and I think like my cholesterol and my fasting glucose. I'm still going to do that tomorrow. I already had an appointment with my family practice doctor for next Thursday. But she's going to meet with me today. And then, and her medical assistant was so sweet when she called me today, because I called and left a message. The front desk wasn't helpful. But I just asked if I could leave a message with the medical assistant. And she called me back, and she was so sweet. But she's like, yep. She's like, Dr. Shanley's going to meet with you. And she's like, and then you can meet again and talk more in a week in case you have more questions. So I feel really well cared for there. Like I said, so I go to a hospital here in Anchorage called Providence. And I've always loved going to their imaging center. And everybody there was amazing. But there are now going to be so many upcoming appointments and things and decisions to be made. Something I'm already a little stressed out over is, so since I've been in perimenopause and menopause, I have been on hormone replacement therapy. In fact, I just had a whole bunch of blood work done and I will be seeing my gynecologist next week as well, to probably get me on an estrogen gel, because we think my absorption, maybe this is a blessing in disguise, I don't know, my absorption of the oral estradiol that I've been taking for my hormones, that I'm probably not absorbing it very well, which I guess can be a thing for certain women. So for some women, it's better to go to a gel application, and it's also better for your liver. I was going to be meeting with her on Tuesday to see what my levels were, but oh, you guys, I tell you what, being on hormones has been, well, before this now, a godsend for like my symptoms, but in particularly osteoporosis, dementia, heart disease and osteoporosis run very strongly on my mom's side of the family. I already have osteopenia. I've got hardware in my spine. I just had a DEXA scan. On the same day I had my annual mammogram, I had a DEXA scan, and I had to get an MRI for my shoulder because I fell a couple of months ago recording a video for my YouTube channel, and I have jacked up my shoulder. That's a side note. But my DEXA scan showed that I was slowly increasing my bone density on my lower spine, but my femoral neck has continued to lose bone. So I don't relish getting off of hormones, but obviously if I've got a type of breast cancer that is hormone responsive to estrogen and progesterone, well, that's a problem. And I keep thinking about these glucose hacks and how important it will be for me to eat in a way that is optimum to help my body. And I've been really working on increasing protein lately. Oh, I don't know what the weeks are going to bring forth. It has been crazy. But, as a person of faith, I know that God has me. He's always had me. He had me before I knew what was going on. I feel so blessed in the way that he's just moved things along. Even getting to talk with my doctor today. She's such a great doctor. I have an amazing family practice doctor. I know she is going to recommend me to a wonderful surgeon. Do you know what I've also learned? And I know I'm going to be learning so much more. That, say if I need a mastectomy, or that's like the recommendation or something like that. And I've already, even before I even knew what was going, or before I knew like a diagnosis, I have already decided that if that's what I have to do, that's what I have to do, and we'll just be fine. And I'm like, if 2.0 better be better looking than these. But, they've served me well, and this is the thought that I've had to have. And I'm sure there'll be tears. It's going to be an emotional roller coaster. But if more than a lumpectomy is recommended, depending on like what I've got in family history, making peace with that, and then, moving forward with some type of reconstructive surgery. So there are just like so many things. Like wow. So if you're anybody who's watching this and you've gone through this, I'd love to hear about your experience if you feel comfortable sharing. All right, well, I will sign off here. I'm about out of space. I will keep you up to date. I'm sure there will be a lot unfolding, and I'll keep it here in my health playlist under a special DCIS playlist, or maybe I'll just do a separate DCIS playlist, and maybe it'll be a help to somebody as I go through this journey. All right, I will see you in the next video. Bye-bye.